There you go. Thank you. Professor Kay?
Good evening. Good evening, everybody. On behalf of the Departments of Health and Nutrition Sciences and Kinesiology, Department for Health Promotion and Brooklyn College Health Clinic, welcome everybody to the webinar. We appreciate that you have taken time out of your busy schedules to join us this evening. My name is Jolanta Kruszenicka, and I'm here with Professor Horek Romanowski, Professor Michelle Green, and Ms. Wendy Baumann. However, Professor Horek Romanowski is going to be in charge of tonight's meeting, and she will tell you what to expect.
Thank you, Professor Kay. If you can, I'm just going to mute everyone so we don't have some feedback. Thank you. Good evening and welcome everyone. This evening we'll celebrate student stories and questions about the COVID-19 vaccine. We are going to hear from 5 students who are sharing how they came to get vaccinated, what it meant to them, and their voyage from hesitating and being maybe doubtful. And then we're also going to hear from and welcome Wendy Baumann, our physician assistant from the Brooklyn College Health Clinic. PA Baumann will respond to some of the questions submitted in advance, but also towards the end of the webinar, we will address questions that you can submit in the Q&A. So feel free to submit questions in the Q&A as we move along. PA Baumann, or Wendy Baumann, has been at Brooklyn College in the health clinic for 13 years. And that is after a career of 20 years in internal medicine in Manhattan. But we also have lives outside of Brooklyn College. So Wendy Baumann is dedicated to health promotion and student health, but she is also a mom, a singer, an activist, and a lover of nature and animals. So welcome, Wendy, welcome Professor Kruszenicka, and welcome Michelle Green, our undergraduate deputy in the Department of Health and Nutrition Sciences. I think I left out your title. So Professor Michelle Green as well. And once again, I want to encourage you to feel free to submit your questions in the Q&A and chat. And we will all, of the faculty, will field questions towards the end of the webinar. We'll take questions that we feel comfortable responding to. And any questions that we are unable to address in this webinar, or we will jot down, we'll keep the transcript of the meeting, and we will make sure to try to respond to those after the meeting, either directly to the person who asked the question or to everyone who attended the meeting. So as I mentioned, we have 5 students who a lot of students actually sent vaccination stories or reflections on their vaccinations, and I just want they all know that the ones we have selected, they all know that they will be presenting. So I'm just going to check in the attendant list that we have. So I'm going to ask first for Mel to share your story. And so I'm going to turn off I'm going to give you permission to share. That should be, let's see, I'm sorry. Technical difficulties.
Hello, Professor. Thank you for this opportunity. Can you hear me well?
Yes, perfect. Go ahead.
Didn't give it too much thought. When I first heard the news of the virus's appearance in Wuhan, China, I didn't give it too much thought. I didn't expect the world to change so drastically. All my family and I could do with the little knowledge we had was to protect ourselves. My parents suddenly started to obsessively disinfect anything and everything after the virus started to spread. We took very serious measures to keep ourselves safe during those first few months. It was difficult because supplies ran out very fast in the stores near us. Although it was annoying, I understood that it was necessary to be safe. Our priorities were my baby sister, who was only 9 years old, my college-age sister, who will soon be staying on campus and attending in-person classes, and my mother, who's a teacher for very young children. My father worked from home, and my classes became fully online, so we focused on my other family members. Looking back, this was an incredibly stressful situation. I wanted it to be over as soon as possible. I deeply missed what the world looked like before the pandemic. I was used to being a homebody who spent most of the days encased between the walls of my own room. However, I suddenly found myself craving to be outside, interacting with people, eating with my friends outdoors, and feeling the sunlight on my face. I realized then how important it was for people to be outside and around other people. It occurred to me that I had been taking these small things for granted. I desperately wanted to go back to the way things were. This partly contributed to my decision to get vaccinated. My immediate family members, my parents and my 2 sisters, were never against getting the vaccine. In fact, my parents scheduled our appointment as soon as the vaccine was available. Hearing about the vaccine being developed was like a glimmer of hope for us. We were eager to be vaccinated with the hopes that things would get better. In addition, my parents both studied biology when they were in college, so their knowledge of vaccines and infectious diseases contributed to their decision. My parents also encouraged me to consume unbiased media and get my information from credible sources to make informed decisions. However, although we should encourage everyone to get vaccinated, I think it's incredibly important to acknowledge the reasons why some people may not want to get the vaccine or are vaccine hesitant. For example, it's the fact that Black Americans have been heavily mistreated at the hands of the US government and the medical/healthcare system. The most infamous example is the Tuskegee syphilis experiment, where African American men were used as test subjects to track the progression of syphilis under false pretenses. Not only this, but racism towards this community in the medical field has been present for years and sadly still continues to this day. This is a position that not all of us can relate to or understand the emotional impact of, so it's incredibly necessary to consider multiple perspectives when we're encouraging people to get vaccinated. Thank you.
Thank you so much for sharing that and for sharing that additional perspective. So with that opening, Wendy, and that context, now I'd like to turn the mic over to you to address some of the questions that we received in advance of this webinar. Wendy, you're muted.
Okay, sorry about that. So what I did was I divided the questions that people submitted into categories. And some of the questions were actually not about the vaccine, but just about COVID in general. So I thought I would start with those questions. And then in the next block, I'll start to answer questions about the vaccine. So I'll read each question and then answer it to the best of my ability. So the first question is, why is the reaction to COVID so different for different people? And we know some of the reasons why, and sometimes we don't know the reason, but the biggest factor seems to be the state of the person's immune system. So for example, older people, as we age, our immune systems are not as effective at clearing viruses. And also older people are more likely to have an underlying medical condition such as diabetes or high blood pressure or cardiovascular disease. Another risk factor seems to be obesity, which can also impair immunity. And it can also be the cause of excess inflammation in the body. And obesity also makes people more at risk for other diseases such as diabetes and high blood pressure. People with lung disease and people who smoke are more at risk because these things compromise lung function. And then any illness that suppresses the immune system makes people more at risk for severe disease. So things like diabetes, HIV, cancer, autoimmune diseases. And in addition, any medication that suppresses the immune system, like chemotherapy, immune suppressants that are taken for organ transplant or autoimmune diseases. So these are factors that can make people more prone to having severe disease. But sometimes, people who are young and seemingly healthy get very, very, very sick with COVID. And sometimes older people who have a lot of medical problems get a mild disease and recover fully. And we don't really know the answers yet. There are hypotheses that there are genetic reasons that make someone more susceptible, and this is being researched. And some people who seem perfectly happy might have some sort of genetic immune deficiency that we just don't know about. So much more research being done on this. And then the next question is, how will we prevent variants from spreading so rapidly? And the thing to know is that as long as COVID-19 continues to spread, it will evolve and variants will develop. So stopping the spreading is the way to slow the development as well as the spread of variants. So the most important thing is to get vaccinated and encourage others to do the same. And in addition to that, people need to follow the established guidelines of mask wearing, especially when inside, where the vaccine status of others may be unknown, or when outside in crowds, to maintain social distance, to avoid large crowds indoors. When you are indoors, make sure there's good ventilation. And finally, to make use of testing prior to getting together with people, and to isolate if you've been exposed. And the next question is, why are new strains of the COVID-19 virus more deadly? And the answer is not all are. There are mutations that are actually happening all the time, and some just kind of appear and then fizzle out. The mutations that are more, quote, successful and become more efficient and thus more easily transmitted is that some of the variants, the mutations that happen, allow them to grow more rapidly and in the respiratory tract, and that thus makes illness more severe. With Delta, changes in the spike protein made it better at evading immune response. And it replicates very quickly. And because of this, might be more likely to infiltrate the lungs, which is what is the cause of severe disease. And we don't know yet about the newest variant, about Omicron. We don't know. There are a few things we are starting to know, but because it's so new, there's a lot we don't know. So we actually don't know if it's going to cause more severe disease. It's pretty certain, though, again, we don't know for sure, that it is more contagious, that it's spreading very quickly. But we don't know the severity of the disease. And that just leads me right into the next question. Is there anything about the Omicron variant we should know? Well, we should know any information that's being figured out, but there is a lot still unknown and a lot of research being done right now. And what they have figured out, other than that they think that it spreads quickly, is that that people are much more protected if they actually get their booster. They know this about the Pfizer vaccine, not about the others yet. Let's see. Oh, how can you tell the difference between COVID and flu? Can a doctor differentiate between the two? Can you get both COVID-19 and the flu? I sort of lump these together. And the answer to, can you tell the difference? Clinically, no. The symptoms overlap a lot. Fatigue, malaise, headache, congestion, cough, sore throat. The one big symptom that often happens with COVID, but from what I'm reading is not happening that much with Omicron, is loss of taste, the sense of taste and smell. That does not generally happen with the flu. So the way can a doctor differentiate? Really, the only way to differentiate is to test. And there are rapid flu tests and there are rapid COVID tests. And yes, you can get COVID-19 and the flu at the same time, and I don't think you want to. I don't think that would be a good thing. And then the last just sort of general question about COVID, not about the vaccine, was, are there fewer cases of flu now that COVID-19 has come to be a big problem? And last flu season, there were way fewer cases of the flu. And it's not so much because COVID-19 exists and has just taken over. It's because of the precautions that people were taking. It's because people were wearing masks and distancing and for trying not to gather indoors with large groups of people. And we don't really know what's going to happen this flu season. December is really the start of it starts a little early, but December, January, February are the big months for the flu. So, and people have become much more lax, and it may be a big flu season. We don't know yet. So that's the end of the questions, the general questions about COVID. So I don't know if you want to go to the next person.
I think, well, thank you so much, Wendy. I think maybe we would move on to the next student story.
Yeah.
I think I misspoke. I think we have, if everyone shows up, we have 6 stories. But there's a couple of students who are not here right now. So I want to ask if favorites, if you would share your story. I'm going to promote you to panelist.
I'm here. Hi, everyone.
Hi, favorite.
Hi, my name is Favorite, and I'll be reading my story. Okay. Something that I still find hard to believe is that roughly 2 years ago, in the middle of a spring semester, everything changed for me and many others. I remembered being in class hearing about COVID-19. COVID-19 had yet to have a name. It was simply a virus traveling from country to country. I heard about it in the morning news in the days that followed and heard many speculations. When COVID-19 reached the US, I was volunteering as a tax preparer. Sometimes before class moved to be fully online, students talked about it. Some students sounded scared, but I wasn't. Soon after, before my volunteering program ended, everything was put to a halt. I was home with online classes for the first time in my college years. Work for me was unfamiliar. Before COVID-19, I was working part-time as an Amazon shopper at Whole Foods. Had 4 to 5 classes on campus, then volunteered on the weekend as a tax preparer. But everything changed and my world was turned upside down. It started with work. Usually it was easy, nothing out of the ordinary happened, except when COVID-19 began. The line at the stores was longer than I have ever seen in 2 years. The store shelves were empty. There were so many products that were out of stock. At that point, anxiety for me started to creep in. I stopped going to work soon after. My dad avoided going to work too. My dad has diabetes. He was scared for his life. He was highly vocal about it, which brought me even more anxiety. School life was no different. I had to use an old computer from home for classes, which hinted that the experience wasn't great until I brought a cheap laptop, my first laptop in my 21 years of life. Nothing changed after weeks. Everything became scarier and more unfamiliar. I have this vivid memory. I was walking to my house and the B-103 passed by me, and everyone who sat by the window had a surgical mask on. Days went by, weeks went by, the death toll in New York continued rising. I have friends that have family members who died, and my reaction to the death didn't change once. A student I went to high school with passed away with COVID-19. When I heard about faculties from Brooklyn College who died, my heart ached. If someone asks how happy was I when a COVID vaccine became available, I was more than satisfied. I did every research that I could to find the legitimacy of the vaccine. At that point, I started an internship with a nonprofit that aimed at helping the African community in the Bronx, helping them find resources and setting COVID-19 appointment for them. When it came time for my age range to take the vaccine, it was a moment. I felt safe and felt a sight of relief for the first time in what felt like a very long time. Now I go out in the street advocating for people to take their COVID-19 vaccine. Thank you.
Thank you so much, Trevor. It's really appreciate your story, and thank you for your work in the field. Much appreciated. All right, so now I think, Wendy, do you want to turn back to your next section?
Yes, I will continue on, and the rest of the questions are all about the vaccine. All right, so the first question is, how come the vaccines were able to be developed so quickly? Which is a really good question. And I think there are a number of reasons why. One is that there was a pandemic and there was a sense of global urgency that was spurred by the pandemic. And in addition, there was global cooperation for research and distribution. And researchers mobilized very quickly to share the mRNA technology, which actually was not a new technology. It had been already studied for over 20 years. And in addition, there was enormous funding, which allowed for multiple trials to be run at the same time. And there were very rigorous guidelines for clinical trials. And finally, there was a high interest from volunteers for vaccine studies, which social media actually helped enormously in reaching and enrolling volunteers. So that is how it was developed so quickly. And I think it's very important for people to know that not any of the safety measures were skipped in the development of the vaccines. The next question, if you have antibodies from the first 2 doses, do you still recommend a booster shot? Here's the thing about antibodies is that we know that the vaccines enable the body to create antibodies to fight COVID. But what we don't know yet is what the level of antibodies actually means. But they do know that over time, the antibody levels in people's bodies do decrease, they do wane. And so that is why, yes, the booster is recommended, because as your antibodies wane, then you won't be able to fight COVID as well. And the next question after that is, will we have to get a booster? Will it become mandatory? I don't know the answer to that. It's possible, and it will probably be on a state-by-state basis. What are the pros and cons for taking a mixed booster shot? And what that means is the pros and cons of your booster being a different vaccine than the one you got originally. So if you got Johnson & Johnson, getting the Moderna, for example, as your booster. And there are a lot of pros for mixing the booster. And again, this is something that is in the developing stages of being researched, but there are some things that are known. So some of the pros are, if you're in a category for whom there were rare but serious side effects discovered since you received your vaccine, for example, with the Johnson & Johnson vaccine, it turns out that in rare cases, women who are under 50 are at an increased risk for a blood clot. You may not want to get, if you're a woman under 50, the Johnson & Johnson as your booster. You might choose to get Moderna. Or with the mRNA vaccines, the Moderna or Pfizer, for younger people, young adults, there was a rare side effect of getting myocarditis. In that case, you might decide to get the Johnson & Johnson as your booster. The other pro is that they're finding that mixing different vaccines might produce a more robust immune response since the vaccines work differently. And the cons are that it's possible that some of the unpleasant, not dangerous side effects might be increased, such as fever, fatigue, headache, and that research is still underway about this. So there are things we still don't know, as goes with COVID. There's still a lot we don't know. The next question is, will our vaccine technology be able to withstand mutations of the new variants? Which is a good question, and it depends on the variants. We still don't know exactly what's going to happen. We know that there have been breakthrough infections with Delta, and likely there will be more breakthrough infections with Omicron because it has more mutations on the spikes. And but the researchers are working really fast to modify the vaccine so that they will work against the new variants. So work is continuously being done and figured out amazingly quickly. Next question is, some people I know that took the COVID vaccine got sick for a few days after. Why is that? Interesting question. There are so many different reactions to the COVID vaccines. From some people have absolutely no reaction. Some people just have a pretty sore arm for a day or two. And some people feel lousy. Some people have chills and fever and headache. And sometimes that lasts for just 2 hours, sometimes a day, sometimes 2 or 3 days. And I think the why to that is just we all have different immune systems. And so people just react differently. Are there any harmful side effects for taking so many vaccines? And I'm not sure exactly what this question means, so many vaccines meaning a lot of COVID vaccines or having COVID vaccines and the flu vaccine. But the reality is, at this point, most of the side effects are mild and resolve within a few hours to a couple of days. And we don't know yet about long-term side effects. Again, something that is being studied right now. It's looking unlikely. But again, there's still so much we don't know. If I'm vaccinated for COVID-19, do I still need to be vaccinated for the flu? Well, yes, if you want to be protected against the flu. The COVID-19 vaccines do not protect against the flu. So you do need a flu vaccine. And the next question, which fits right in here, is can the COVID vaccine and other vaccines, such as the flu vaccine, be given at the same time? And the answer from a safety standpoint is yes, it is okay. I know many, many people who have gotten their COVID booster and their flu vaccine at the same time, and they've been fine. I don't personally recommend it because if you have a reaction to a vaccine, you don't know which one it's to. By the same token, if that's the only way you're going to get both vaccines, I think it's a good idea to get them at the same time. If the new variant is mild, is the new mandate for private businesses necessary? Well, we don't know yet if the new variant is mild, first of all. There has been speculation that that the cases of COVID caused by Omicron are not as virulent. But the tricky thing about COVID, so Omicron is a new variant, and COVID progresses. Sometimes people can be mildly ill for 7-8 days and then get very sick. So we really don't know yet whether it's mild. And what might be mild for one person, for someone who is immune compromised or elderly or has, underlying medical problems, it might become a very serious illness. And so part of that getting the vaccine is not just to protect ourselves, it's actually to protect others as well. Should people who are in cancer treatment get the COVID-19 vaccine? And the answer to that is absolutely yes. The thing with chemotherapy and radiation is it does suppress the immune system. So people who get the vaccine, who are in cancer treatment, need to know that their response to the vaccine may not be as robust. And they are advised to get a third vaccine, which is different from a booster. So they should be getting 3 vaccines and then a booster, and then continuing to take really strong precautions, masking, social distancing, not being inside with large groups of people. They have to continue to be very careful, even though the vaccine does give them some protection. So that might be a good place to stop for the next person to tell their story.
Okay, fabulous. Perfect timing.
Excellent.
So we have our next student who would like to share their story. I'm just going to promote to panelist is Bezaline. Let's see, it takes a moment to get promoted. There you go. Bezaline, whenever you're ready.
I'm ready. My name is Bethelina Judah, and I'm going to read my COVID story. I view life as a precious gift, and I look forward to spending quality time with all my loved ones as we make memories together. Seeing my loved ones happy brings me a sense of joy and content. I pride myself on the mantra, as I cultivate positive habits, my life grows more beautiful. In January of 2020, we all heard the story of COVID-19. By March, cases started rising rapidly. People began to panic as calls were being made to employees to work from home. I was one of them, and my eyes remained glued to the news. I also began to conduct my own research on that virus. Since there, I learned of many conflicting studies daily. My thoughts raced daily and caused me to be in a state of panic daily. As time went by, a vaccine was invented by scientists, and that assisted in decreasing my overall level of anxiety. From my point of view, I know that vaccines are the best tools we have to prevent diseases and premature death. Today, 90% of babies are vaccinated, and this practice has existed for decades. Many existing studies have validated the benefits of vaccines and have based the theories on experiments. However, the COVID vaccine was developed in such a short period of time, and that caused widespread hesitancy. I waited to see side effects of people and their overall reactions. I also noted the fact that hospitals were being filled to capacity and thousands of deaths were reported daily. This definitely shaped my decision to take the vaccine. I immediately made an appointment for my household to get inoculated as well. I realized it was not only for me, but for those around me. Within 1 week, my family members were able to get their first dose. The shot was quick and painless. After receiving my vaccine, I realized that it was painless and hassle-free. As I gathered more info about vaccines, I began to trust scientists a little more. Being vaccinated made me feel a sense of empowerment. Another reason I took vaccine is that I have family members with many pre-existing medical conditions, and taking it would indirectly protect them. I urge everyone to get vaccinated. Vaccinations save lives and decrease the incidence of premature death. Thank you very much.
Thank you so much, Bezaline, for your story. And back to you, Wendy.
Okay. So the next group of questions is about pregnant women and children and the vaccine. And the first question is, which represents a greater risk, COVID-19 disease or COVID-19 vaccine for pregnant women? And the answer is, without a doubt, COVID-19 disease is much more dangerous. Women who are pregnant are at a much higher risk for getting severe disease with COVID. They're at a higher risk for preterm delivery. And it's interesting how quickly things have changed, because when I did a Q&A in the spring, they were just starting to do research on pregnant women, and they were recommending the vaccine, starting to, but they weren't sure. And now they are recommending without hesitation that pregnant women get the vaccine. Would you recommend fully breastfeeding mothers to get vaccinated or wait until they are done breastfeeding? And this is a question that not that much research has been done yet about. There's limited data, but there are some reports that suggest that that breastfeeding women who receive the vaccine will pass the protective antibodies from the breast milk to their babies that will hopefully protect the babies from COVID. No idea yet how long that protection might last. It's important to remember that the vaccines do not contain live virus, so there is not a risk of passing the infection to the baby by getting the vaccine. It is recommended at this point for people who are breastfeeding to get the vaccine because it protects you against COVID, which in turn protects your baby against COVID. So it's recommended, but there still is a lot of research that needs to be done about it. Okay. And then the last question in this category is, will newborns and children eventually have to get vaccinated? I don't know about the have to. I know that, meaning children under 5, that research is being done. And from the reading that I've done, it seems that for children between the ages of 6 months and 5, there will likely be vaccine available in the spring of 2022. Whether that will become mandated eventually, I don't know the answer to that. Okay, I think that is it for all the questions that were that people submitted prior to this.
Okay, great. Thank you so much. I'm just going to double check our attendees to see if we have any of the other candidates who are in the meeting. And if not, we can start. I see there's other questions in the Q&A. So I encourage Professor Green, Professor Kay, and I think we also have Professor Morotznik in. I can promote you to a panelist, and PA Bamman, Wendy Bamman, feel free to choose questions from the Q&A and respond to them.
Okay. I can start with the first one.
Okay, fabulous.
So the first one, is there any data reports on the vaccine giving women any issues with infertility? And the answer to that is no. There is absolutely no data that says that the vaccines contribute to issues with fertility. I think one of the confusions, because especially with the mRNA vaccines, when people hear mRNA, they get worried that it's going to somehow affect our DNA or our genes. And I think one of the things that's very important for people to understand about the mRNA vaccines is, first of all, the mRNA does enter our cells, but it doesn't go into the nucleus of the cell, which is where the DNA is. And it just gives our cells information to create the protein, that the spike protein that our body then develops antibodies to. And once it's given our body that information, the mRNA leaves our body gets rid of it. So as far as they know, there is absolutely no effect on issues with fertility from the vaccines.
Thank you, Wendy. Professor Kay, I think you were attending to a question on the,
Yes, I just answered to a question that was that somebody posted. Is it mandated for small children enrolled in public schools to get vaccinated? So I provided a quote from the New York City website, and I strongly advise you to go to the sources that are credible. So that will be on the federal level, it will be CDC. And then, of course, there's on the state level, Department of Health, but mostly in New York City Department of Health or NewYorkCity.gov. You will be surprised how much information is there. So I found the recent information about how children will be required to be vaccinated, smaller children. So from 5 to 11, starting on December 14, children will be required to show the proof of vaccination. So rather the parents that their children were vaccinated. Children cannot get vaccinated by themselves. Don't understand that like incorrectly. Until 18 years of age, parents are required to give permission to any child to be vaccinated. And older students from 12 up, they will be required to show the second vaccination, so full vaccination, starting December 27th. I also posted a link where that notification is posted, and you can find out a lot of information about that, and also questions, answers, and those questions and answers, they can be translated to many languages. So I hope that maybe we can actually share could I share the screen with everybody for a moment?
yes, you should be able to.
So I just wanted to show the website because actually my students were quite surprised that it is possible. So you'll see that, yes? So this is a key to New York, to NYC, that's the program. And this is the website, New York City Department of Health. And actually I just typed requirements for vaccinations. But look on the right side, you see the names changing, the names of languages. You can translate that to different language. And look how many languages you can translate that text to. So if you have any family members, any neighbors, any friends, or anybody in your community who speaks different language or reads different language, you can actually show that information for them and just click on that. I would say, let's click on Arabic, and that site pops out in a different language, and you can access actually a lot, and posters also in multiple languages. So any site here, you see on the right hand side, you can actually switch language to the language that is needed. Thank you. So you have a link.
Thank you so much. I also posted the link in the chat. In the Q&A, the answered questions are in the second tab that is called Answered. So just, oh, I should be kind and turn on my video. So thank you, Professor Kay, much appreciated. Wendy, I think there's a second question for you about mixing vaccine doses.
I saw that, yes. So yes, as I said before, you can mix vaccine doses, and if you received Pfizer but only have access to Moderna, get a Moderna booster. It's totally fine, and it's much better that you get a booster than not get a booster. And as I said before, there is some evidence that mixing and matching provides an additional boost to our immune system, since they're all slightly different. Even though the Pfizer and the Moderna are very similar vaccines, but it is absolutely fine to mix.
Thank
And I'll just add that more research is, as I said before, more research is being done about that.
Right. Thank you so much, Wendy. Really appreciate it. So I'll take the next or question about how we can adjust the role of the tension between Black or African American in the medical field in vaccine hesitancy. And this is obviously, we cannot undo history or repair history in a short period of time. So part of it is, and this is not a complete solution, but part of it is to, one, acknowledge that that tension exists, that the lack of trust exists, and it is a perfectly valid hesitancy, and it's a strong source of hesitancy, and it does not only affect the Black and African American community, but maybe most predominantly, we have many examples in US history of the medical field exceeding and using excessive powers to affect people's personal lives, both in disease, but also in fertility. And that's in part why we have these many conversations around what does this new vaccine do to people, and that fear is well rooted in history. So part of it is to have conversations about it, acknowledge that it exists, and also begin to have conversations about the source, and to verbalize and vocalize some of these concerns and address them with medical professionals in both in the hospitals and clinic settings, having conversations and open conversations like these, where we open up for some of those difficult questions and acknowledge that they exist. But it is a long process of repairing a fraught history. So that is in part why we also wanted to bring the student perspective into this session, was to acknowledge that I think we all have to acknowledge that I hesitate, as much as I am convinced that vaccines are one of the major weapons in this process. I hesitated, and I thought, am I being too trusting of the establishment? So I think we also have to acknowledge that there is a lot of hesitancy, even among those of us who are supporters of the current approach. All right, so
I cannot address another question about the politicizing vaccination. So the question is the pandemic getting a vaccine and COVID-19 restrictions have become very, very politicized. What is the impact of this, and how can we mitigate it? Very simple thought. Viruses do not pick people by color of their skin or politics. They affect everybody the same way. So why are we really discussing different issues, or being allowed the politics to getting involved in the area where science supposed to be the one that is giving us the answers? And I remember hearing about climate change, when politicians said, do not listen to scientists because they don't know. Yes, listen to me. And now again, the politicians are getting injected into that conversation where there's no place for that. I mean, their role, the politics or politicians' role, is to help to protect society, to protect everybody. So I really get very disappointed when I hear statements about from different political fractions. On the other hand, you also have to understand that when people get affected by it, everybody are getting affected by it. Actually, we have discussed that in the class, in my last class, that actually what the effects of this disease affect the whole society. And somehow we have we hear constantly to have that blurred away, that that somehow we are so privileged, and so we should be independent. But Professor Kyoka and Kuzumi very smartly described attitude in Japan. She said that when she was growing up, everybody were telling that we have to support each other, because individual person cannot survive without others. So this is a very wise attitude, I believe, and that's why Japan is being so successful in having those restrictions. People actually obey them so much easier compared to others. So somehow we have that message blurred out that you know we are the most important, not the others. So the question is, where will you get the food if everybody in your deli will get sick, or worse, if they die? Who's going to take the trash in your building if they really get sick? So we have to have that global, well, not only individual, community perspective, but also global perspective into importance of protecting everybody. Try to think about that, and then talk to others slowly. I'm sure that people will get into similar conclusions. Thank you.
Thank you so much, Professor Kay. We have a lot of questions in the Q&A. Let's see, I think maybe Professor Green, this question would be good for you. Do you think the lack of health literacy in the general population contributes to vaccine hesitancy? How can public health individuals address this?
Well, we know that scientists may not be the best communicators. They speak in the language of science, and we speak in the language of the life world. The average reading level in the United States is about the 8th grade level. And people who are poorer, where English is not their first language, have lower health literacy and indeed lower general literacy. And we have to pay attention to the language that is used both by professionals and with each other, that we have to use words that people understand. We have to recognize that we don't know everything, as Wendy described, and to be forthright about it. Science does not have all the answers. Science never has all the answers. Medicine doesn't have all the answers. And it's okay to say that, because that is the state of the world right now. And we just have to be cognizant of that. And we have to pay attention to where people are at. Where are they? Why don't they believe in getting a vaccine? We have to find out what is it about their backgrounds, their culture, their beliefs, and listen. Listen to them rather than telling them what to do. And trying to understand where they are coming from, and providing support by giving them the information that they need in words that people can understand. And don't get angry, don't yell. That's not going to solve anything. We may be very frustrated. Many of us are confused about why this is happening. How can this be? But that is not going to get people to change their minds. We have to listen, and we have to figure out where they're at and how we can work to encourage them and support them.
Thank you, Professor Green. And if you'd like to learn more about that, take the health communications class in the spring. Thank you. Anybody, PA Bamman? Do you have a question that you'd like to address? There's one about whether the vaccine will become part of our yearly immunizations.
I always forget to unmute. I can't tell the future, but my guess is that probably it will become a regular part of our lives and likely will become part of our yearly immunizations. Don't know for sure, but that's the way it's looking to me right now. I will just add, you know, I was hesitant to get the vaccine too. I mean, I think that's a very common sentiment around something that we know not a lot about, and we're in the middle of this pandemic where it's hard for us to think clearly, and we're all scared, and you know, but I just kept trying to gather as much information as I could, and it just seemed clear to me that it wasn't just about me, it's about the world, and that there wasn't another answer. If I thought there was another answer, I might have headed in that direction, but I didn't think that there was. I think that this is the answer. And are we guinea pigs to some degree? Absolutely. But that's okay, because we're, you know, we are all together in this. And so taking the vaccine is for ourselves and for our community and our loved ones.
So if I may, I'd like to continue that thought just a bit further. We may think of ourselves as guinea pigs, but we are always guinea pigs whenever we are receiving any form of medication. And I want everyone to think about the many times in their lives when they accepted a medication from a medical professional and they, without question, have accepted that that was the best choice and the best treatment. And for many medications, the effectiveness is far lower than it is for these vaccines. Many medications work for a third of the people who receive them. That goes for blood pressure medications, lipid lowering medications, pain medications even. They work very differently in different people. And so we are used to taking a lot of medications and vaccines, by the way, at face value, and accepting that our medical professionals have one, vetted the evidence, and also that the FDA is doing its job of monitoring these medications in practice. And so I just want to say that the effectiveness of these vaccines is extremely high. And so that's what really convinced me that one, as P.A. Bamman said at the beginning, no shortcuts were made. The only thing about the phases in the clinical trials was that some of them were conducted in parallel and not in succession. And so we have the same magnitude of evidence that we have with any vaccine that comes out on the market. And so I just want to make sure that we put that out there, that we now have this scrutiny on the vaccines for COVID-19 that we never have exhibited for any other medication in our lives. And so that really is what convinced me that this is something that I would trust and that I felt very comfortable also recommending to people around me. And then I wanted to follow up on another point. So many of you are my students or have been my students and know that my focus is public health, right? That the population is the patient. And what has happened with vaccines in the 20th century is that vaccines used to be public health events. You would meet in the town square, or everybody in the school would get vaccinated at the same event, and it would be a public event to be vaccinated. And as our vaccination rollouts have become medicalized and moved into the medical practice, they have become private events and individual decisions. And so that has elevated this individualistic approach to vaccinations, that they're an individual choice where, and one of our students wrote this is about herd immunity, right? So Beverly actually had a sentence. She said, herd immunity is what we're aiming at. And that only works in the aggregate. That only works if enough people have immunity. And so in part, it's that we no longer see each other get vaccinated. We no longer bring all our babies to the local event at the town hall to get vaccinated, or ourselves. There is, once you go to get COVID vaccine, I did get my booster on Friday last week. It was sort of, there was an atmosphere of being in this together and sitting and waiting and being monitored after getting the shot. So there is some publicity around the COVID vaccine that's actually kind of new, that we are doing it together. So that is, that's actually, for me, that was very reassuring to see other people sort of coming together and doing this together as a society.
Could I add a couple of things off of that?
Absolutely.
Yeah, well, maybe not as much in Brooklyn, but I live in Manhattan. As far as the sort of feeling of community, is that there are COVID testing sites on the street all over the place. And, you know, people are meeting strangers at the COVID testing sites and chatting as they're waiting for their test results. And then there was one other thought I had. Oh, the thing about herd immunity and the variants, you know, if we need a greater portion of the population to be vaccinated, because when people aren't vaccinated and more people are getting COVID, that is when we have the chance for more variants to arise and more mutations. And eventually we might end up with a mutation that the vaccines don't touch at all. And we don't want that to happen.
Hello, Wendy, I think there's a question for you from Patricia about the
yeah, yes, you still have a rash around the shot. As long as it's not getting worse, no, there's no reason to worry about it. It will eventually just resolve. But if you have a follow-up question, if there's anything else you wanted to tell me about it, 2 days is not very long. It'll probably go away within a week.
Can I address one of the issues? I'm sharing the link right now to Vaccine Finder and would like to share the screen with you. Those of you who are looking for a place to get vaccinated, so that you can even Google it, yes, Vaccine Finder or COVID vaccine, and you will get to that website. Again, the government website, they are very reliable. And look, you can select COVID-19 or flu, yes, or, you know, so that the search is live. But if you switch to COVID-19, you can also select certain vaccine that you want. So for instance, imagine I'm entering Brooklyn College zip code. I don't know what, I'm sorry, I don't want to take time, but if you enter the zip code, you will see locations around you, and that will be the pop out, you see, so this is important. So those are those tracks, and some of them are just moving, so they are, you know, sent to different places on different weeks. So that's why this link is very good. You also have walk-ups. You can select just sites where you can walk, or you can get by wheelchair. You should also be aware that people can get vaccination at home. Before, only people over 75 years old or people with pre-existing conditions, they could get walk-in vaccination at their own home. Right now, even children can get, you know, vaccination at home if this is requested. So again, look for that website and for the information. And I need to like stop sharing. Thank you.
Thank you, Professor Kay. We have 2 more questions, and of course, feel free to add to the questions. I think Professor Green, maybe this is for you. Another health communication question. How can we communicate medical information about the virus in a way the general public can understand? Do you think difficult medical jargon contributes to lack of knowledge, awareness, and on such issues?
Yeah, as I said before, I think that we have to recognize not to be using technical language and jargon, which is how scientists and physicians tend to speak. So we have to use words and phrases that everyone understands. Sometimes it's referred to as living room language. Just talking like you were talking to someone in your living room about what's going on. Yes, there's a lot of medical language, a lot of jargon, even a phrase as simple as, and this was early in the epidemic, that the president at the time referred to the development of the vaccine at warp speed. Well, we are not living in a Star Trek world. This is our real world. And to refer to it that way, as if there's some kind of science fiction element to it, warp speed, it's not accurate and it gives the wrong picture. So language is very, very important, and we have to be wary about the language we use. And I just want to go back to the notion of vaccine hesitancy again. That I think you've heard almost all of us talk about our own vaccine hesitancy. And while I wasn't particularly hesitant with the COVID vaccine, and I'm not quite sure why, but I think I was a firm believer in Dr. Fauci. He kind of, he convinced me that it was something that I should do. But in the early years of when the human papillomavirus vaccine came out, the HPV vaccine, and my friends were sending their kids to get the HPV vaccine, and I was vaccine hesitant then because it was new, it was untried, and it was my girls, my daughters. And I said, no, I'm going to wait. I'm going to see what happens. So if we were to do it now, I would say go for it. But frankly, my daughters never got that vaccine because I was one of those, what they refer to as slow adopters or non-adopters of that vaccine. So I understand why people are hesitant. But we have a lot of information now, as we do about the HPV vaccine, a lot of information. And we have to get people to encourage people to get the vaccine.
I'd like to add something else in here about vaccine hesitancy. I think that there's been a lot of misinformation about the vaccines and a lot of conspiracy theories that are widely believed, and it's hard to diffuse that once those ideas get into people's heads. And I'm not sure I know how you do that. I know several people who still think that microchips are being implanted in people's bodies from the vaccines. So I don't know, but I think addressing the misinformation that has been put out there is really important, and getting accurate information to people.
And as public health professionals, we need, if we see that online, we need to counter that misinformation. Find out if the website you're looking at is a good website. Is it reliable? Is it created by someone sitting in their bedroom having nothing else to do? Or is it by some legitimate organization? If you look at a website and it says .com, you want to be careful. If it's .edu, you're in much better shape. Even a .org might be better. But you have to be able to evaluate the websites you see. Social media is filled, as Wendy says, with misinformation and conspiracy theories. And the public health community needs to get out there on social media and counter some of those claims.
I have another link and another share screen, and I hope that you will start looking into those websites. So this is Vaccine Partnership. Since there was a question about how to help others to get vaccinated, so in your community, actually, you can organize that. to have vaccination event, like you know, I had that in my community. But here you look, please look at this. Spread the word. There is a lot of now help on the internet, and you can just sign up for the vaccine train the trainer session, where representatives from the Department of Health will just guide you through how to talk or how to answer questions. But from those links below, look, you can also click and see the videos. And I've actually opened that up before because there was a question also about the trust to medical practitioners. So look, this is our new commissioner, Department of Health Commissioner, Dr. Chaksky. He is very famous now on television and other media. So this is how also they've tried, the Department of Health tries to bring closer medical practitioners, you know, to the community. Another doctor is Dr. Torian, who also is presenting very often on television, those short clips. You can access them in different languages, so you can really share that out with your families and friends. Oh, there's even one in Polish that I will definitely check after this meeting. So please look around. There's a lot of information right now, and especially a lot of links, and there's a lot of data that is published. We are really famous around the world. None of other Department of Health around the world publishes so much information. There's so much clarity, and it just people, they don't look into those websites. There are graphs, there are statistics. On a weekly basis, you have everything updated daily, and you can find reliable information about what is happening. Thank you.
Thank you, Professor Kay. Appreciate it. I'd like to add to that. There's a question here. What should be done to reduce vaccine misinformation on social media? And Professor Green already addressed part of this. But I've spent a lot of my sanity on reading posts that quote scientific evidence and articles from journals, and going back to reading the original article and then providing an unbiased interpretation of the results. So I want to refer back to something that Wendy Bamman said at the beginning about pregnancies and immunization, and particularly COVID-19 vaccines and pregnancy. And there were several, I probably didn't see nearly a fraction of them, but many, many posts that focused on the fact that there was greater pregnancy loss, so spontaneous abortion or premature birth, untrue in women who had been vaccinated. In fact, women who, it was the inverse, women who had been vaccinated for COVID-19, either in the first, second, or third trimester, had the same or better birth outcomes than women who had not been vaccinated. And so I think one of the ways that we can, as public health professionals in particular, is to, whenever, as Professor Green said, whenever we encounter misinformation, is to not yell or get angry, but simply state the facts. This is inaccurate. The findings state X, Y, and Z. And begin, and I've started a lot of conversations with friends who say, oh, really? And I think it is that we have this hesitancy, right? That we seek information that confirm our fears. And so if we can confirm our current stance, we feel safer than if we are constantly challenged by the evidence that comes forward. And so that is a part of the source of vaccine hesitancy or resistance, is when we continue to read only things that confirm what we believe to be true or what we fear to be true. And so even I have to also sort of push the boundaries and have to read things that may question what I believed to be true, to constantly challenge my position. And that's what good science is to constantly question what you believe to be true, whether there is evidence to continue to believe or to trust a particular perspective. So scientists have to be ready to be wrong, but they also have to acknowledge, and we all have to acknowledge that science evolves, and especially when you have a new situation where you have largely no evidence at the beginning, the situation will evolve, and so will the evidence. And so we may have had wrong interpretations at some point, but the scientific community is pretty solidly following along and providing more and more evidence that leads and demonstrates this similar findings across the board. So that leads to a question in the Q&A that says, what do you think the medical/health field could have done better at the start of the pandemic? Testing, vaccine rollout, health communication, etc. What do you think was done well? Anybody want to tackle part of that question? I can start. It's always easy to point at what was done, what was wrong, what wasn't adequate. And so I absolutely, I think even those of us trained in public health and epidemiology were quite taken aback by the lackadaisical attitude at all levels of the government, at the federal government, state government, and city government relative to contact tracing and isolation early in the pandemic. That is my major criticism. I think despite, I'm going to say something positive, despite the challenges of rollout, I think testing in New York City and vaccine rollout have actually been highly successful. I'm impressed by the number of sites, by the number of providers, by the number of opportunities that we have to get vaccinated and tested. And then I'll, maybe Professor Green, you'll talk about health communication, and anyone else feel free to chime in.
Well, I just want to say, and I'll be straightforward and honest about this. I think that the federal government did a disservice at the time that the pandemic first occurred, when a president comes up and in a public statement talks about unfounded cures or treatments for a disease, and then misleads people that way. I think the backlash to that could have been even stronger than it was, that there were people who were kowtowing to the president. If you can recall, not so long ago, when that fellow in the White House, I hate to even say his name these days, talked about using, what was it, bleach or chlorine to get rid of the virus. And a physician sitting next to him didn't say a word, didn't say, no, this doesn't make sense. We should have had people saying that, who could have been stronger, braver, more forthright, to counter the misinformation that was distributed by the president at that time. And that was a concern for me. And again, what Professor Horlick-Romanowski said about, we followed people on the internet and in newspapers for those who followed what we believed. And if you think that bleach is going to cure you of the virus, and you're going to find all sorts of places on the internet that will support that assumption, and we have to look at where those websites are, who develops them. The phrase that's used is an echo chamber. We listen to things that we want to hear, that we say, and we have to go beyond that. So I think that at the beginning, that was one of our big mistakes.
I'll add that I think one of the big mistakes at the beginning was how long it took to advocate for mask wearing. That if we had told everyone at the beginning, at the very beginning, to wear masks, which is, if you think about it, so it makes so much sense, and how long it took for them to say, oh yeah, aerosols, not just droplets, when you didn't really need to be a medical or scientific genius to figure that out. And I think it would have made a huge difference in how things have gone if everyone had started wearing masks right away. And of course, if they hadn't become so politicized, which is now such a huge problem.
Should I add 3 sentences? Yes.
Yeah.
Surprisingly, again, the Department of Health was very slow in the response. We know there are health disparities, and not addressing that immediately was a very big mistake, because if you have lack of information, the misinformation will just replace it. And with current opportunities to have access to millions of people, anybody who was speaking up had an audience. So that void was very quickly filled with wrong messages, with people who were just stating their opinions, and they are repeating other opinions again. And this is like a village gossip. Yes, you tell it to your neighbor, and that neighbor tells it to anybody, the next person, and here you have a gossip, and it grows and it changes, and it really, in this case, it has done a lot of damage, not only by more people getting sick and unfortunately dying, but also by losing trust. Right now I have shown you those fantastic websites and links and information, but it took months to actually build them up. The Department of Health has been addressing health disparities, and by joining with community representatives from the beginning. And I have attended meetings twice per week for the first 6 months, or maybe 8 months, and people from the neighborhoods, from the communities, were telling what is needed. And there was very slow response to those requests. So it is definitely a lesson that we have learned, that has to be addressed much sooner, because if no one addresses the uncomfortable questions, then there's going to be always somebody who will just stand up on the chair and yell in the crowd whatever they think, and people will follow. So that was definitely not a good response. Thank you.
Yes, thank you for that, Professor Kay. I think it's also important, the question was about how can we address the role of health disparities during the pandemic. I think the challenge is that health disparities are not new. The pandemic has illustrated how profoundly they affect everything in our lives, whether it's the jobs we have, or the incomes we have, or the housing security we have, or the food security we experience, with our trust in the medical establishment. And then, of course, health disparities are the result of living in inequitable conditions that lead to health disparities in health outcomes. So those who are already affected by housing insecurity, income insecurity, et cetera, and structural and institutionalized racism are also affected by higher rates of underlying conditions, chronic conditions that increase the susceptibility to COVID-19. So this is an example simply of a disaster just highlighting how unequal and inequitable our society is and how inequitable health is allocated to people. So I think this is not just a COVID-19 or a pandemic issue, but the pandemic has once again highlighted what we've known for decades. And it has illustrated that if we really want to tackle the vulnerability of our population, we have to address that underlying issue. So we have one more question on the vaccine effectiveness. Maybe, Wendy, do you want to take that?
I don't actually know the answer to that.
Right.
I know that it wanes, but I couldn't give you a percentage.
Can I share my story? My whole family got COVID. My son was first. He received Pfizer, and he got sick 3 months after having the second dose of Pfizer. And both of me and my husband got Moderna, and we were 4 months after getting Moderna vaccine. And my son is considered super healthy young man, and I'm considered very healthy. My husband is semi-healthy. We all got sick, and of course my son was first. So this is also that taught us really the lesson of responsibility. He is the one who got sick first. He had symptoms, and after a few days I got sick from him, and then my husband got sick after both of us. It's not fun. We have to keep talking about that. So those breakthrough cases really happen, intensified with Delta variant. We don't know about Omicron, so that's why you hear constant information about getting booster shot. Yes, because that, again, you know, the 6 months or 4 months is based on observations. This is not something that is being given by definition. Yes, those things are changing. So we don't know when the next booster shot is going to happen, if it's ever going to happen, if we have to get the booster shot. So just follow up on the advice and have open mind to that. Currently, we have to just brace up for the next wave of COVID, and it's very important to also remember that around us are people who may get much different outcome. Yes, my son got better after 3 days, and I was sick for much longer. So there is, thank God nothing is more seriously happened. But those, people get sick because somebody brought the disease either to their community, their home, or their neighborhoods. So that's unscientific sharing. Thank you, Wendy, for addressing it. But we need to also speak up about our cases. And students started also sharing in my classes that they got sick as well. Somehow, that we don't want to feel shame of getting sick or being pointed out as being weaker. I can tell you, my son is super healthy, and he got sick despite having 2 vaccinations. So it is a powerful lesson to everybody that actually it does happen to everyday people who do, and we were protecting ourselves, wearing masks. Well, not my son. I mean, he was wearing masks, but probably not always. Thank you.
Thank you, Professor Kay. I want to thank everyone who attended. And I want to thank everyone for all of the excellent questions. And we want you to continue to submit questions to the Department of Health and Nutrition Sciences. I also encourage you, I'm going to put the link to our YouTube channel in the chat. Okay, that didn't go to everybody. Hold on. I'll do that again. So I'm going to put the link to the Health and Nutrition Sciences YouTube channel where we host all of the videos from our events. And if you're curious, so from tonight, but also from our event from last week, where we had Professor Muse from biology, who is a microbiologist, who spoke about the differences between COVID-19 and the flu. And I think one of the biggest misnomers in this whole situation is the lack of understanding of the complexity of the human body. And he speaks very eloquently about the both the interaction between the viruses, the flu and COVID-19, and the human cell and different types of cells and the different components of the cells. So I encourage you to watch that video as well. And then I just want to reiterate what Professor Kay said, that breakthrough infections happen. They happen with all our vaccines. They happen with chickenpox, with measles, mumps, rubella, but they are milder cases when they tend to be milder cases when they do happen. And I think that's what we have to bear in mind, that right now we're seeing a surge in infections in even in highly vaccinated populations, but the level of hospitalization is so much lower. So I think that's an important lesson to remember. And then I want to thank Wendy Bamman for fielding all the questions and for your evidence-based responses. For Professor Green, for your information specifically on health communication. We need to figure out how to teach scientists to talk to health educators to deliver messages, or at a minimum, learn how to speak to people about science. And Professor Kay, of course, for your enthusiasm and being my partner in crime and getting these things together. And for everyone who is here, thank you. And we want you to be safe out there, but reach out if you have questions still. And we hope you will get vaccinated. We understand that everyone is at different points in that voyage. And then we really look forward to seeing people in person in the spring semester. So thank you, everyone, and have a good night.
Can I add one thing?
Yes.
I would like to mention that we are, our department is offering one more semester of the COVID class. This is a seminar class. It is a very unusual class, a course, because each week different faculty member is talking about the area of their own expertise, and they address issues of COVID based on what they know the best. So this is an unusual class. We have been doing that, all my colleagues, for the past 2 semesters, and that course is going to be run once more. The number is 5191. So this is a seminar course. It's fairly easy. It can be counted in the health and nutrition sciences for either 6 or 12 credit group, but it is open course to all students in Brooklyn College. So we really are, we would like all students from different departments to join that and to learn from this pandemic and from those, you know, so many different areas that should be addressed.
And let me just add, there are no prerequisites for this course. The intent was to open it to the Brooklyn College community.
Thank you.
Thank you, everyone. Yes, you registered for 5191, the seminar course in COVID-19. And also I want to reiterate, you can ask questions to the practitioners at the Brooklyn College Health Clinic at the email. You can also get your flu shot at the health clinic and lots of other healthcare services. The Brooklyn College Health Clinic is exclusively for Brooklyn College students. So do take advantage of that fabulous opportunities. And thank you again to everyone who was here.